Let's go.
Hello, everyone. Thank you guys for joining us. Welcome to the 2021 UNC Water and Health Conference. My name is Allison from the Water Institute at UNC, and I am the room host for this. Before we get started, I have a couple of announcements to share. First, we have networking events for this day, or for the day. Join us on Remo this afternoon to connect with colleagues and sponsors alike. Please note that you'll need to register an account on Remo, but instructions are posted on our website now to do so. Also at 3:30 is a Careers in WASH event for young professionals today. It's an exciting panel to learn about opportunities for careers in WASH. There will also be breakout sessions to talk with some of the panelists, ask questions, etc. It seems like an exciting session, and I hope to see you there. For our participants around the world who can't make it to live session, join us tomorrow morning for a recap of today's event. The late early show will discuss how to apply today's lessons to Southeast Asia and Pacific. These have been exciting and lively discussions, so please feel free to join them in the evening if you're in North America, join them in the early morning if you're in Southeast Asia, and mid-morning in Australia. And just a reminder, this session is being recorded for folks who cannot attend the live session.
I think it was charging up there.
So this session is being recorded for folks who cannot attend the live session. Just a reminder, throughout the presentation, you'll find that the chat feature on Zoom is disabled. Okay, please direct all questions and comments to the chat tab on Passable. I will be monitoring the chat tab to refer all questions towards our presenters. And if we don't get to your question during the time allotted in the Q&A, we'll have our presenters try to respond afterwards. We're really excited for our presentation today. So first we have Caleb Cord from University of Colorado Boulder, Dr. Kaycie Lane from the University of Massachusetts Amherst, and Poulin from the Quiet Institute. They will be sharing their exciting work pertaining to community and rural water systems. That is it for our announcement today.
All right, Caleb, can you just make sure we can hear you, and then I'm going to be sharing my screen because I muted everybody, and then I think I muted all the hosts too.
Yeah, you asked me to unmute.
Okay, awesome.
Cool.
All right.
Hi, I'm Caleb Cord, and I'm a PhD candidate in environmental engineering at the University of Colorado in Boulder. I'm also a researcher on the USA Sustainable Wash Systems Learning Partnership, which for the last 5 years has been researching and learning promising approaches to better understand and strengthen the systems delivering water and sanitation services. And right now I'm going to be speaking more specifically on some of our recent research, identifying pathways enabling high consumer contract retention for promising rural water maintenance interventions. I'm going to briefly talk through the background and methodology for this research in order to get to the results, which is the primary focus of this discussion, but additional information is available on the methods that we used and the supporting documents that we've uploaded alongside the poster. Rural water infrastructure is failing, mostly due to weak systems for maintenance. But professionalized maintenance arrangements demonstrate a possible solution to this problem, where legal, appointed, and regulated service providers guarantee functionality to rural consumers in line with contracts in exchange for their payment. These approaches are being implemented and scaling across sub-Saharan Africa, and in literature and in practice, they demonstrate widespread improvements in functionality and service levels. But less is understood about how the local service contexts where they're implemented influence their sustainability. We can characterize these local service contexts as enabling environments, composed of operational conditions, which are more in the control of the service provider, such as tariff setting, and contextual conditions that describe that service provision context, composed of political, social, natural, and physical conditions that are much more rigid and difficult for service providers to control. This research studies contract retention, which provides us a good indication of operational and financial sustainability for these arrangements. Essentially, in places with high contract retention, customers are willingly renewing contracts each year, providing us an indication of their buy-in for and demand for the arrangement, and making required payments, giving an indication of their willingness to pay for this higher level of service. We partnered with Wave, a rural utility operating in Uganda, serving over 10,000 customers in 11 different districts, to examine both the contextual and operational conditions influencing contract retention across diverse service contexts for WAVE implements. We asked, what pathways of conditions enable high contract retention for rural water maintenance provision? We employed fuzzy set qualitative comparative analysis, or FSQCA, which is a structured and replicable cross-case comparative method using set theory and Boolean algebra to determine the extent to which each of our cases falls into the set of the outcome, in this case, contract retention, and a handful of conditions hypothesized to lead to that outcome. It incorporates simplifying assumptions and detailed case knowledge of each of these cases to uncover condition combinations, or pathways as we call them, to high contract retention. A lot more details are available on our specific use of FSQCA in those supporting documents that we've made available. But we were drawing on 5 years worth of service records, looking at 22 unique service contexts for WAVE implements, based on 12 months of my fieldwork alongside the service provider, looking at 200 qualitative documents, 101 semi-structured interviews, and 5 focus group discussions. And we identified 2 unique pathways to high contract retention, both of which included 2 essential conditions: local government participation and consistent expansion. Local governments essentially act as the rural service authorities in much of sub-Saharan Africa, and therefore their participation in these arrangements is first and foremost a legal requirement. But they hold really important relationships with communities and can leverage these relationships to increase trust, transparency, and accountability between the service provider and its consumers. Consistent expansion from the service provider in the area essentially normalizes new concepts such as tariff payments and entering contract agreements, and further legitimizes the service as consumers see their neighbors and neighboring communities signing contracts as well. The only other condition required to enable success in all of our successful cases but one that retained the majority of their contracts over the last 3 years was coordinated sector aid, where NGOs and other implementing aid organizations in the area were aligning their efforts with each other and with the government's mandates for implementation. For example, not providing free repairs and construction that can minimize the achievements of the local government service provider to motivate consumer demand and satisfaction, as well as willingness to pay. Only one case was able to achieve high contract retention without coordinated sector aid. And in this case, depended much more on 2 physical conditions: large user communities that were much easier to access in order for the service provider and their local government partners to counteract the effects of uncoordinated aid in that area. Our results speak to a few important conclusions. Local government participation is necessary for high contract retention. Without aid coordination, the potential for success is limited and multiple failure pathways emerge, so we haven't represented those in this specific poster. Social and political conditions are sufficient on their own, demonstrated by pathway A, regardless of natural and physical environments, to enable contract retention and professionalized maintenance arrangements.
Thank you, Caleb, for your presentation. If you could share your screen. And in the meantime, if anyone has any questions for Caleb, as we wait for people to maybe put in some questions, I was wondering if you happen to know if WAVE was a private utility or public utility?
Yeah, so the answer to that question, I guess, is a bit fuzzy. WAVE is a like privately registered company in Uganda, but they work through a public-private partnership with the local government in each of these areas. So they have like a formalized contract agreement with each of the local governments and kind of work hand in hand with them through regular public-private partnership reviews. So it's a bit of both. WAVE kind of acting as the private maintenance company, the service provider, but also relying on support, regulation, et cetera, from the local government.
And so are all the results found from this, or are all the results from WAVE customers?
You mean in terms of like data collection for this research?
Yes, sorry.
Yeah, so the data collection included several different populations of people. A pretty heavy one was so I guess if we kind of move into like this part of the poster, so we were drawing on like 5 years worth of WAVE service records that included quarterly customer satisfaction survey results, for example, from communities, as well as a handful of other like monitoring reporting forms, things like that. And I think we had close to 3,000 pages worth of documentation that was coded and analyzed as part of this. We also had 101 semi-structured interviews. These were with the local government actors themselves. So, you know, a lot of these conditions and a lot of the results of this research point to the importance of local government support for these arrangements. And as professionalized maintenance becomes hopefully a more common thing across rural sub-Saharan Africa, input and especially regulation from local governments is going to continue to be more important, which is what my next poster video at the end of the session is also going to touch on. And then focus group discussions that were held with hand pump mechanics, field office staff from WAVE as a utility, as well as their management staff in their main offices. So a lot of different people that were part of the data collection effort for this research.
Great, thank you. There is a question from Ben Tiswell asking, can you talk a little about local versus national here in terms of context? Were there any hints about national level factors there that influence the results? Or would you want to see results from other countries separating?
Yeah, so, you know, so all of the cases in this research were sub-national context in Uganda, but as a part of this research, we really kind of compiled a long list of a lot of the, what we call constant conditions in the use of QCA, which were the conditions that didn't vary across these contexts, maybe because they're just like in place at the national level in Uganda. For example, supportive policies being in place. Uganda passed a new national operation and maintenance framework at the beginning of 2019. Again, that I'll talk about in that second video that's coming up. But some of those like national level conditions, no doubt, play an influence in, you know, in the provision of professionalized maintenance, and we may see differences. I think that Uganda is a fairly representative national context for a lot of countries where these approaches are being implemented across sub-Saharan Africa. But, you know, for example, there are models like the Water for Good professionalized maintenance model operating in the Central African Republic, which would be a very different context. And for future research would definitely be interesting to unpack, you know, how those operational conditions might have to look different to play into that context, as well as how, for example, you know, lack of continuity in government and things like that might influence contract retention for professionalized maintenance. So national context definitely important, but you know, I think that a lot of components of Uganda's context speak similarly to other national contexts where these approaches are being implemented right now.
Great, thank you for your response. You do have another question in the chat for you, but that wraps up our time for Q&A now. As Caleb mentioned, we'll be presenting a part 2 to this at the end of the session, so be sure to stay tuned. And Caleb, in the meantime, if you want to respond to the question in the Q&A, feel free to do so. But our next presenter is Dr. Kaycie Lane with the University of Massachusetts. So, spotlight first, now feel free to share.
Yeah, 1 second. Okay, it sort of froze on me. Okay.
Hello, everyone. My name is Kaycie Lane, and I'm a postdoctoral scholar at the University of Massachusetts Amherst. And the study that I'm working on compares centralized treatment to point of use or point of entry treatment for very, very small systems. So the idea behind our study is to take a look at point of use or point of entry devices in comparison to a centralized treatment improvement. So a small system has an issue and it needs to provide a solution. And the idea is that we're going to compare these two different options using what's called a triple bottom line analysis. We're going to look at human health impacts using an exposure assessment. We're going to look at environmental impacts by using a life cycle analysis. And we're going to look at economic impacts by using life cycle costing. And so we've selected 4 different communities across 4 different EPA regions within the United States that are all very small water systems. All of these systems have a groundwater source, have inorganic contaminants within their systems, serve less than 500 people, and have had a violation for a maximum contaminant level rule in the US in more than 1 year. So we've selected 4 different communities. They have either arsenic or nitrate contamination in their system. We've looked at what's currently going on in the centralized treatment system in these communities, and we've come up with an upgrade that we could put in place for each of these communities. We've then also selected 2 different point of use or point of entry devices for each community from different companies and that have different certifications. So the idea is that each community is a little bit different. It gives us a little bit more information about the differences between centralized upgrades and point of use and point of entry devices. And the way that we compare these 2 options is in 3 ways. So first, we're looking at time to implement. How long does it take to implement a centralized treatment improvement versus a point of use or point of entry installation? And does the exposure that a human population experience, is that higher with a centralized treatment improvement based on the time it takes to implement, or is that higher with point of use and point of entry based on the time to implement that device? Our second analysis is a life cycle analysis. So the idea is that we are looking at those 2 different options from the raw materials through manufacturing, use, and disposal of those devices or those improvements to the system, using what's called the SEMA Pro software to conduct an LCA. And the idea is that we're looking at a volume of water produced and trying to understand what the environmental impacts are. So impacts such as greenhouse gas production, energy use, and ecotoxicity. The final analysis that we're using to compare the 2 different options is a costing analysis. And so we've started by using some EPA cost models that have been previously developed and adapting the assumptions within these models to fit specifically to the community water systems that we're working with. And then we're looking at both installation costs at the outset and ongoing cost over a 30-year time period. And so the end result of our study is to try and be able to provide communities with a decision-making framework based on multiple analyses. The idea is that if a community is considering a point of use or point of entry solution or a centralized treatment improvement, they can look at either exposure, sustainability, or costs and make a judgment. So we're not coming up with one aggregate score. At the end of the day, we're looking at 3 different options for a community. And I'll just say a brief quick word of thanks to the people at the WQRF who fund this project, the state drinking water programs, and the community water systems working with our team. They have been extremely helpful in this process.
Great, thank you so much, Kaycie, for your presentation. If anyone has any questions, please put them in the chat. Sharing your screen. As we may be waiting for people to enter in the question I have is, what are some next steps to help community water systems use this framework for decision making?
Sorry, I was just trying to find the unmute button. So I think, we've looked at specifically very specific contaminants. We've looked at inorganic contaminants such as arsenic and nitrate. So I think some of the things that we could look at in the future is other contaminants as well. In the system, we're looking primarily at oral exposure and like an oral ingestion route, and there are other ways to potentially look at exposure. So there's kind of a lot of little spin-offs potentially from this work.
That's awesome. Have you been able to help a community water system apply this framework?
So our study is primarily a desktop study. We weren't able to travel to communities because of COVID, but we have been working with individual community water systems. And part of the criteria that we had with selecting communities was to look for communities that are considering point of use or point of entry as an actual solution. And that is a solution that could be implemented in the state where that community is located. So we're still kind of finishing those analyses, but the hope is that when we have those cost numbers and those exposure numbers, that we can share those numbers with the communities we've been working with to at least inform some decisions in the future in those communities.
Yeah, If anyone has any questions, feel free to put them on the chat tab. But we still have a couple minutes for Q&A. So if there's anything you would like to share about your research,
Sure. I think one of the interesting things that we're learning is that how point of use and point of entry devices are implemented in the United States varies quite a bit from state to state. There's different rules, there's different regulations, there's different requirements in order to have these devices be used. And sometimes it depends on the contaminant that you're using it for. Sometimes point of use is allowed, but point of entry is not, or vice versa. So there's a lot of very state-specific things that have come up that are kind of interesting in terms of implementation.
That's very cool to hear, and I can imagine the variety of issues across the different states. So very cool work to extrapolate on. We do have a question. What lessons have been learned?
So I would say on top of those state-specific concerns, I think one of the things that we're finding from talking to community water systems and getting a sense of how long it takes to implement these solutions is that there's a lot of unanticipated costs when it comes to point of use and point of entry systems. It seems on the surface like this would be an option that can be quickly installed under somebody's tap and it runs and it works. But in terms of using those devices for compliance purposes in the US, there are lots of requirements for sampling and for operating those devices that add to ongoing operation and maintenance costs. That I think is kind of an interesting thing that we're finding from talking to state administrators that have looked at point of use and point of entry over time.
So much. That wraps up most of our time for Q&A, but feel free to add questions or comments into the chat as you need, and correct them as questions. Thank you so much for your presentation. Now we will move on to Chloe. Let's keep it quiet. Share your screen and so this is
Yeah, 1 second.
Hi everyone, I'm Chloe, a research and program manager at the Aquia Institute, and today I'm going to present the performance of a novel AI-based proxy-means test called AI-based PMT to target proper water subsidies in rural Ghana. In Ghana, only 54% of the poor have access to basic water services versus 94% of households in the richest quintile. In addition, the COVID-19 pandemic and the economic shock associated with it have made water access even more difficult for consumers in sub-Saharan Africa. So subsidizing access to safe water services for the poorest is critical to improve safe water access. Although subsidies are common in the water sectors, they are largely ineffective because they are often failing to reach the very poor and usually benefit high-income groups. Different methods have been developed to better target poor households, and among these methods we can list community consultation, proxy-means tests, and in Ghana, the government initiated the LEAP program, which is a combination of PMT and community consultation developed to target extremely poor households. So in this study, we developed a new AI-based PMT using artificial intelligence and compared its performance and acceptability against the LEAP program and community consultation. We first developed a new AI-based PMT using machine learning techniques like feature reduction and predictive modeling, and we used data from the Ghana Living Standards Survey to predict the household poverty status relative to the Ghana National Poverty Line. As a second step, we surveyed 818 households in 3 rural towns of southwestern Ghana. The survey questionnaire included the 47 variables needed for the AI-based PMT, and we asked whether the household were enrolled in the LEAP program. We also conducted community consultation in parallel. Then we interviewed local and national stakeholders and community members to understand their preferences. To compare the methods against each other, we first assessed their performance by representing the risk of inclusion errors, non-poor predicted poor, and the risk of exclusion errors, poor household predicted non-poor. A good method must have a low risk of inclusion and exclusion errors. For every 5 households identified as poor by the methods, represented by the brown square, we looked at how many are truly vulnerable, in dark green, how many are wealthy, representing the inclusion errors in red, and how many are left behind, representing the exclusion errors in light green. The best method must have a low number of red houses, representing the inclusion errors, and must not exclude too many poor. In other terms, not to have too many light green houses. In our case, you can see that the AA-based PMT performed better than the 2 other methods, with a low risk of inclusion and exclusion errors. In terms of stakeholders and community members' preferences, local officials have no preferences between the PMT and community consultation, and their main concern about the PMT is the risk of lying. For community members, they prefer the PMT and ranked community consultation in a second position because their major concern about this method is that poor people might be forgotten or might be afraid to share their true poverty status. No one would use the LEAP program as it's perceived as influenced by politics. And finally, national stakeholders required clear and transparent eligible criteria, and thus would prefer the community consultation over PMT. So we saw that the different methods have different strengths. In terms of performance, the AA-based PMT performed better than LEAP and community consultation. But in terms of acceptability and scalability, meaning ease of implementation and cost, community consultation was better. In terms of scalability, AA-based PMT is the last model because it's the most expensive one. All the households have to be surveyed, and its implementation required a lot of computation. So if stakeholders want to prioritize performance, we would recommend the AA-based PMT, but if the priority is transparency and or scalability, we would recommend community consultation. But after our discussion with stakeholders, some of them didn't exclude the possibility of combining 2 methods together. So we checked the performance of community consultation and AA-based PMT combined together. We conducted the 2 methods in parallel and then merged the lists together. You can see that the performance are better. There's a lower risk of exclusion errors compared to the AA-based PMT alone, the light green houses, and the same risk of inclusion errors, the red houses. So this method combination would increase perceived fairness and transparency, would increase the performance, but also increase the targeting cost, even though it was not an issue for the stakeholders we interviewed. Thank you for your attention.
Thank you so much, Chloe, for your presentation. If anyone has any questions, please put them in the chat. In the meantime, I have a question. What inputs does the AI-based PMT use to identify qualifying households?
So we have a set of 47 variables that we selected from the GLSS dataset, which is a living standard survey that has been done by the government of Ghana. And so on this dataset, we apply some machine learning technique and feature reduction. So we had at the beginning around 600 variables, and with like these feature reduction techniques, we managed to decrease this approximately 600 variables to 47 variables. And so this is these variables that were included in the survey for the AA-based PMT model. And the kind of question is, for example, the type of household, the material construction for roof, or floor, or the walls, also the expenses of the household, to know what did they purchase during the past month, and small question like this.
Oh, that's quite impressive. Could you see the AI-based teams being applied in areas outside of rural Ghana?
So if it can be applied outside rural Ghana. So this model like this is really specific to rural Ghana and to southern part of Ghana, because the machine learning technique, so we apply this machine learning technique, so as I said, to the GLSS dataset, but on this GLSS dataset, it's a national survey, but we excluded all the north, and we also excluded the big cities. That makes like this specific AI-based PMT really specific to southern part of Ghana and rural Ghana. But it's like completely feasible to rerun the feature prediction on the entire GLSS dataset that include northern region. So we can have AI-based PMT specific to the entire Ghana, or if we want one only to the north, we can also exclude the southern part of Ghana and to just focus on north part of Ghana. So this one, the one I presented, is really specific to rural Ghana and the southern part, but with further analysis, we can like develop another method for other specific part of Ghana.
Great, and along those lines, how do you think this framework could be adapted to different regions / contexts?
Sorry, you break up a little bit.
Someone is asking, how do you think this framework could be adapted to different regions / contexts?
Yeah, I mean, it's just like a matter of computation. It's like super easy to adapt. It's just like to rerun the model on, for example, only one region in Ghana, and then you will get like different inputs. It's just a matter of like what you like the feature reduction. When you do the feature reduction is like on what you do it. If you want to do it on only a specific region, it's fine. It's super easy to extract only one region from the GLSS dataset and then to apply the feature reduction on this specific region.
We still have another minute left of Q&A, so if you want to take this time to share anything about your research, feel free to do so.
Yeah, thank you. So I think as our next step will be to try this combination approach to combine the AI-based PMT and then to have either the results validating by the community consultation, and then to have feedback again with local stakeholders, national stakeholders, and community to see if it like really increased transparency and fairness. So I think it would be our next step, just to try this method combination directly on the field to see how it is perceived by the different stakeholders, but also by the community members.
That's great to hear. Hope to see you next year to hear a little bit more about how this works out. Thank you so much for your presentation. If anyone else has further questions, feel free to message on Pathable or add it to the chat. Next up, we'll be welcoming back Caleb with
My name is Caleb Cord, and I'm a PhD candidate in environmental engineering at the University of Colorado in Boulder, as well as a researcher on the USA Sustainable Water Systems Learning Partnership, where for the last 5 years, we've been researching and learning about promising approaches to help us better understand and strengthen the systems delivering water and sanitation services. Now I'm going to be presenting on the results of an analysis identifying institutional influences on local government support for rural water service sustainability. Again, I'll pretty quickly go through the background and methodology, so more details are available for these documents we've uploaded alongside the poster in order to get to the results and focus most of the discussion on those. Professionalized maintenance holds potential to solve rampant non-functionality that's largely left from decades of unsupported and inadequately implemented community-based management that's largely failed to realize service improvement. Professionalized maintenance features dedicated service providers, contractual agreements, regulation from service authorities, and tariff payment to ensure sustainability. And new policies are beginning to emerge that promote professionalized maintenance of rural water infrastructure, such as Uganda's new O&M framework that was released in 2019. New policies like this, however, generally shift roles and responsibilities among key actors in rural water service provision. For example, the local governments, who often act as service authorities in these contexts. And in the face of changing roles and responsibilities, we wanted to understand, how does the institutional environment where these local governments are acting influence their support for professionalized maintenance? For example, their willingness and ability to follow up on these roles and responsibilities as they're allocated. We began with a document analysis, identifying changes in roles and responsibilities by comparing the new O&M framework to Uganda's existing and former policies, and then followed up with local government actors themselves. We conducted 93 semi-structured interviews to collect data on the various constraining and enabling influences on local government actors' decisions and actions. And we balanced these interviews between technical and political respondents within the local government structure. We then qualitatively coded and analyzed this data based on any referenced role or responsibility that came up in the conversation, and then any influence that was cited to affect that role or responsibility in its fulfillment. And we were looking at roles and responsibilities based on the service delivery cycle is how we were characterizing those. Where essentially infrastructure, for example, a hand pump, begins in infrastructure development through construction and moves into the service delivery cycle phase of the cycle, with administration and management, O&M, direct and indirect support, before at some point falling into disrepair and looping back into the infrastructure development cycle, typically for rehabilitation. And so we were characterizing roles and responsibilities based on this cycle, and we were characterizing influences on roles and responsibilities through the lens of organizational institutional theory that defines the pillars of institutional influence as regulative, normative, and cultural cognitive. And to illustrate these pillars of influence, it's helpful to use the recent example of why someone might choose to wear a mask into a grocery store in the time of COVID-19. A regulative influence would motivate a person to wear a mask into a grocery store because there's a sign on the door saying there's a local ordinance or policy in place mandating that you wear a mask or face a fine. And so you wear your mask in order to avoid that formal sanction. The normative influence for why someone might wear a mask is that whether or not there's a policy in place, you may choose to wear a mask into the store so that your friends and your peers don't more informally sanction you for not wearing a mask. Cultural cognitive influences would be that you don't care as much about the formal or informal sanctions that might come from not wearing a mask. You're doing this because you have a deep intrinsic belief, for example, a sense of collectivism, and feel that you must wear a mask regardless. Our results show largely that regulative influences were cited by far the least often, the lowest relative frequency of cited influences on action for service delivery function. Normative influences were cited the most often at 35%, included things like relationship expectations and political dynamics of local politicians and election season. Cultural cognitive influences came in at 24%. Cultural beliefs motivating action, for example, the belief that water is life and should be available for free, as well as notions of identity. And then a few other influences that weren't captured by organizational institutional theory. And our results speak to a few important conclusions. For example, regulative influences like this new policy in Uganda are unlikely to motivate local government support on their own unless allocations of roles and responsibilities are in line with normative and cultural cognitive influences. Existing influences, like these norms that we've identified, can motivate local government support because every single one of these cited influences across all three pillars was referenced by at least one actor to motivate actions fully in line with Uganda's new policy. And so if the right messaging and incentives are in place, this can motivate local government support. And local political actors hold important relationships with communities and should be involved in professionalized maintenance from the beginning.
Thank you so much for your presentation. If anyone has any questions, feel free to add them to the chat tab on Passable. Gail, if you'd like to share your screen of your poster, that'd be great. I also thought that the mask mandate was a very helpful comparison to explain things. Very cool.
Yeah, thanks.
While people may be adding stuff into the chat, I wanted to ask, what sort of actors were interviewed for this study? You mentioned that there were 93 semi-structured interviews.
Yeah, so we were interviewing within those same study contexts from the first study I was talking about. So as part of like developing those 22 case studies of these different sub-counties in 3 different districts, we were doing interviews with both technical and political local government actors. So what we mean by that, technical actors would be those who are kind of appointed or hired, usually who have like formal degrees and training, like a district water officer. And then the political actors, who are the politicians sitting on local councils, who are elected rather than appointed. So those were kind of the two branches of the local government that we were focusing on, which are the predominant actors in Uganda. And then we were looking at all levels of hierarchy. So there are 5 levels in Uganda. So we had actors at the district level, the county level right below that, sub-county, parish, and community level. So that's kind of how we got the community perspectives to be part of this as well, was by interviewing what's called the local council chairperson at the village level, LC1s in Uganda, because they kind of act as like the leaders for communities. So a lot of different people, a lot of different levels. Took quite a while to get all that data, but
Yeah, very impressive. Thank you for sharing. We still have a couple minutes of Q&A, so if you would like to take this time to talk about further steps. Oh wait, there is one question just added that I'll read to you. I understand the focus is on institutional influences, but I'm curious about the role of cost and cost perception in this, as professional maintenance services are not just higher quality, but higher cost, which has questions and concerns about value for money, besides ideas about paying for water versus.
So yeah, speaking to that cost perspective, I think that a lot of the costs associated with professionalized maintenance aren't necessarily higher. I would push back just a bit against that. I think that our partner Wave Solutions has put a lot of effort into like cost analysis that's available on their website, which is just whave.org. And SWS has also put out quite a bit of this. I think what the high costs that are associated with this right now is getting these systems in place, getting to a point that professionalized maintenance services are more the norm, as opposed to kind of the uncoordinated swath of different approaches that are being taken right now by a whole lot of different actors in these contexts. But yeah, so this analysis wasn't necessarily taking into account cost of the service being provided, since that wasn't the focus, but cost did come up a lot in resources. For example, this like other box that was 26% of responses, a lot of this was related to resources. And under this regulative pillar, a lot of our references, the influence of an actual policy is even lower, because a lot of those regulative influences were more related to like government funding structures and not being able to get the money that local governments need to fulfill kind of their responsibilities for maintenance. So I think that there's a lot of work to be done in terms of getting more stable financial flows to local governments to be able to finance a lot of this work. Because we do have a lot of evidence that quite a bit of it's being financed, on their own. A lot of these actors, especially the ones that are more supportive of professionalized maintenance, like are doing a lot of this with money just out of their own pocket, which is interesting and speaks to possibly the demand for these approaches at local levels and the potential they have for alleviating a lot of the challenges and burdens that government actors face. But yeah, when it comes to their portion of financing these costs, I think there are a lot of hurdles that need to be overcome for getting local governments to be able to buy in and play their role.
Thank you so much for your answer, as well as thank you for your presentation. If anyone has any questions for any of our presenters today, feel free to message them on Passable or add it in the chat. So just once again, I want to iterate a big thank you to all of our presenters. You guys did a great job sharing your work, all of your very incredible work, which we're very grateful for. I'm going to share screen one last time or wrap up to recap some of the announcements for today. Right now, actually, we have networking and sponsors meet and greet happening on Remo, as well as the careers and watch for young professionals. So have the energy and stamina to hop on to another call. I think these are very exciting opportunities to get to meet new people and learn about some very cool opportunities ahead. We have the late early show next for tonight or tomorrow morning in other times of the world. And these are very exciting sessions for how to apply lessons from today to Southeast Asia and the Pacific region. And thank you guys all so much for using the chat tab on Taskable. If you guys have more questions, feel free to ask. Okay. We've done our presentation or our poster presentation session. We're very thankful for you guys joining us. Thank you guys so much and have a great rest of your day.